Okay, so now you've got your helmet ventilator. The next thing you probably are wondering is how are you supposed to actually use this? What are you going to hook up to it in order to get patients the air and oxygen that they need? And so let's talk about the two ports and what you're going to connect them to. So first of all, I'm not a doctor. I'm not a respirologist. I'm an engineer. And so this is all just based on some of the research that I've done. I have not trialed this with any patients or anything of the sort. Um, but generally, what I've seen with these helmets, the first thing you want to do is you want to attach a filter, an HME. It's usually a unit that combines two things. It's both an air filter to filter out any bacteria, viruses from coming in or out, and these filters have sometimes a feature called HME, which is a humidity barrier. And so one of the problems is that if you have so much airflow going through this helmet, it can dry out very, very quickly. And so the HME, the filters with the HMEs in them will keep the inside nice and humid, comfortable and healthy for the patient. So generally, boom, boom. I don't have any here, but you slap on some filters right off the bat. And then for the port that you're using for air to escape, the exhaust port. That one's pretty easy. After you put on the filter, what you then attach after that is something called a PEEP valve. And so that's a valve that allows you to maintain a very specific pressure inside of your helmet. If the pressure gets a little too high, then it starts letting some of the air out to maintain the perfect pressure. What I would recommend and what I've seen is a PEEP valve, which is actually bi-directional. So what that means is it allows a little bit of air to escape to maintain the pressure. But then if for some reason there's a failure and the pressure drops in the helmet and there's no air coming in order to prevent the patient from suffocating, what a bidirectional PEEP valve should do, I believe, is that it would then allow air to actually flow in the opposite direction if required. And so air can actually flow back into the helmet if there's a failure on what you're using to deliver the air into the helmet. So once again, exhaust side, filter HME, and then a PEEP valve. And then for your port where you actually want to bring air and oxygen into the helmet, so again, a filter should attach directly onto here. It does fit. And then after the filter, you're probably going to run some tubing down. And what I've seen is that tubing eventually goes to one of these. And this is a Venturi valve. And this is one made by Philip Kolber, and this is now his fifth revision, and I'll be honest, it's brilliant. So the elements of it are there's a little tube here, a fitting here where you would hook up an oxygen tube. So obviously you want to deliver oxygen to your patients, so you hook up an oxygen tube here, and then what that oxygen does is it drives the Venturi valve. And so a little bit of oxygen into the middle here goes through this Venturi valve, and this kind of cone shape then uses the Venturi effect to suck in additional air. So this valve kind of like multiplies that little bit of oxygen flow that you put into the middle of it by sucking in air, and you get about 6 times the flow of the oxygen that you put in. It kind of gets multiplied, and then boom, you get a large volume of air coming out the other end. And so this is actually what you're going to use to drive most of the air going into the helmet. And then you might be noticing another fitting here, and this is actually also for oxygen. And so you tee off your oxygen feed, and then you also attach oxygen into here. And this allows you to adjust the overall oxygen concentration that's being delivered to the patient. And so it's a two-step process. You connect one oxygen feed into here, and then you're going to have a little adjustment dial on that. And what you'll do is you'll dial that in until you get the desired amount of just total airflow going into the helmet. And then the second fitting, you also put in the oxygen feed, but you have a separate little adjustment dial on there. And then you can adjust that up and down to deliver higher and higher or lower concentrations of oxygen to the patient. But then, yep, you just hook this up to a hose, to the fitting on the helmet. They're both 22 millimeter male fittings, so hopefully that'll work nicely for you respirologists out there. And the nice thing is that this whole setup, you'll see that the venturi tube is hollow. And so again, if there's an issue going on in terms of risk of suffocation of the patient, as long as your hose is not kinked or the helmet itself is not pressed up against the patient's face, this hose actually through a filter is open to the atmosphere, and so that is a little bit of a safety feature of using this approach in that it's probably going to be less likely that the patient will suffocate. Hopefully that helps some of you, but those are just some tips and some research that I've come across on how you can inflate and deliver oxygen to one of these ventilation helmets.